Hi, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation here at Dreamforce 2022. And joining me right now, I have a special guest. I have the EVP and CRO of Health and Life Sciences for Salesforce, Miss LaShonda Anderson-Williams. So it is so nice to talk with you.
Yes, and welcome to Dreamforce 2022.
Oh my God, my first Dreamforce ever.
Me too.
Oh, amazing, it's incredible, very
Yes.
overwhelming. So we just saw your incredible keynote focused on health equity and also launching a whole bunch of new exciting features on Salesforce with Salesforce Genie, adding to the healthcare cloud. So all sorts of cool stuff. And I just want to dive into you about this focus on health equity first.
Yes.
Because I think it's really exciting that an organization like Salesforce is putting such an emphasis on this. So talk to me a big picture about the thinking on health equity. How is Salesforce tackling it, and how do these new innovations that were just launched really underscore the commitment to improving access to healthcare for all?
Absolutely. So I think there's a couple things I'd call out. I think every customer I spend time with, health equity is a topic, no matter if you're a payer, provider, medical technology, or pharmaceutical company. And the barrier that we are all facing today, things like your age, things like your geography, where you live, your income, your education, it is a real divide, and we have to find a way to solve it. And we think about the barriers to solve this equity conversation. It's really about a few things that I think Salesforce can do really well. And one of those things is really bringing practical solutions that's rooted and powered by data, and making that data the center of how we engage with our patients, members, and customers. For example, things like geography. We can create new ways new engagement opportunities to engage with patients, to meet them where they are. Really, really important, because I talked about barriers like geography. Meet them where they are so they can get the care they need when they need it. Things like health literacy. Another opportunity for us to create more focused and personalized outreaches to better educate patients and their families. We can encourage and engage much more aligned to what their priorities are, but more importantly, helping them understand how to get care and how to get the best type of care given their conditions. And this for us is where Customer 360 for Health comes in. It is designed to put the customer, the patient, the member in the center. What that really means is we're connecting data real time for every sector in this industry to put these individuals in the center of what they do, but more importantly, helping them align to their history and the health of their patients, members, or customers, and making sure that that relationship is connected across every part of the business. So the way I see it is we're powering the business of health through our technology and innovation, and therefore impacting how health outcomes are delivered through our customers.
It's amazing, and bringing up those customers, oh my gosh, right after this keynote, you and I geeked out over the customer stories, so I'd like to share them with my audience. So first, CVS Health. Oh my gosh, the things that you guys are doing with CVS Health are pretty incredible. I mean, they're using you as basically the tech underpinning behind their record, a longitudinal patient record. So talk to me a little bit more about that customer story and what it really means.
When you think about CVS, and it's CVS Health, so if you think about them in this way, think about Caremark, think about CVS Pharmacy, think about Minute Clinic, think about Aetna. They are the company that says they're making healthier happen here, and they do it for over 100 million people around the world. Very, very innovative, but more importantly, what they're doing is they're bringing these systems and tools across every part of their organization and making sure that they can create care that's delivered connected and more seamlessly, and more importantly, more digitally. And that's where Salesforce is helping them break the silos down and meeting patients where they are. And they're doing it in a way that for every person, every community, so that care can be more accessible around the entire world.
All right, and Moderna. Your conversation with Barbara Salami was amazing. And one of the things I love that she said that was related to health equity, a great takeaway for any healthcare organization, you ask yourself, who are we leaving out? I thought that was a brilliant point. What were some of the key takeaways from the Moderna story for you?
Well, number one, you have to learn who Moderna is. As they mentioned, they're a 3,000 employee company. You don't think about them in the same way as you do maybe other pharmaceutical companies, but the 3,000 people there are focused on a mission. And Moderna is focused on opening their platform open to everyone, everywhere, so that they can use the innovation they have with things like artificial intelligence and automation to help make sure that in the commercialization of therapies and solutions, they're making it more accessible to everyone. What I loved about what Barbara said, though, was they do it at a pace that is unseen in the industry. They're 4 weeks. We had one major project that was focused on their call center to make this actually work during the COVID timeframe. It was a 4-week turnaround. And this is a company who had no legacy systems, which is really, really impressive. But they came to us and said, we want to help. And I think the other thing that Barbara said was really important and really critical for all of us at Salesforce is we didn't throw technology at it. We came with a learner sort of mindset of how do we solve the future? How do we solve for where everything is going, and using the technology and again the practical solutions that are powered by data to help inform where they should be creating more commercialization, bringing new innovation through their pipeline. And there's so much more they're going to get ready to do and we're excited to partner with them on this journey.
All right, go high level for me.
Yes.
Big advice. So you deal with, obviously, your customers, and even those who are maybe prospective customers across healthcare, so payers, providers, med tech companies, pharma companies. What's your best advice in terms of the way these organizations should approach health equity? Like, what are some of the practical things that they can do right now? Because even as you said at the beginning of this interview, it's hard, and it's got to be a data-driven decision, and a lot of that data is not widely available. So what's your best advice? What have you been learning and telling your customers to do?
I think there's a couple things that are really important. One, there has to be at the most senior level of these organizations, there must be a commitment to solving equity. And Barbara said it, Joy said it in the process. We talked about, you know, the trade-off of speed and trust and equity. You don't have to do, it's not an or, it's an and. So I think having equity at the center, at the top of the priority list. The second thing is really applying technology where it makes sense to really create more connected systems and tools. The third thing I would say is I asked everyone in the room, we must work together. We actually must work together. And that means all of us in the technology world, across payer, provider, the pharmaceutical industry, we have to find a way to bridge the technologies that we're all faced with and put them in the center, put the patient in the center, and make sure we're surrounding those experiences. But it all starts with equity in mind, and not an or, it's an and how do we thread that across all of the ecosystems in the industry. So I'm excited about the future. There's more to do, and that room was filled with so many great leaders. I can't wait to tell more stories.
Oh my gosh, me neither. And I have to ask you one last question. So geek out with me on this, because I've got a health tech audience that loves talking tech. So I mean, a lot of the new things that we launched, we've kind of been talking about them throughout, right? But the Salesforce Genie that brings in the real-time data, unheard of in healthcare with the real-time data. But other things, virtual care, longitudinal record. I keep hearing about
advanced therapy management,
scheduling, the health. So what are you most excited about? Which one? I got to know.
All of them, because all of them, you know what? I think the innovation we're bringing to the marketplace is a direct response to the challenges we're seeing. But if you think about virtual care, it is a thing. We all now know health has to be capable of being delivered outside of the home. We think about, you know, advanced therapies, and we talked about that today in the example with Moderna. The innovation needs to continue. Why? Because it's our families, it's our communities, it is mankind, and we are committed to partnering with these organizations that want to advance therapies in a much more modern way. And if I add the Genie part to it, I mean, yeah, it's magic, but you know what it is? We want to make sure that we're taking all of the data that's intersected across all of the business of health providers and health payers and clinicians, physicians, and pharmaceutical companies. We want to make sure that we're helping them organize that data to help provide better care, better access, and more importantly, better outcomes. When we do that right across all of these different new innovations, we're going to save more lives, and that's why we're here.
I love that. Well, thank you so much for taking the time to speak with me. Congratulations again on this wonderful event. Enjoy the rest of your first Dreamforce here.
Thank you so much.
Again, LaShonda.
Absolutely. Thank you.
Thank you.
Take care.
Thank you. I'm Jessica DeMassa. You've been watching WTF Health, and for more interviews with the who's who of health tech, as they are changing the way that we do healthcare with a lot of passion here too, check out my YouTube channel. That's youtube.com/WTF Health. We'll talk to you guys real soon. Take care. Thanks again, LaShonda.
Thank you.